Hello, everybody, and welcome to another edition of Inside Career Technical Education. It's so great to have you with us today. I'm Ann Baldwin, one of the hosts of the program.
And I'm Jim Bologa, President and CEO of Porter Chester Institute and YTI Career Institute. And I'm your co-host. Ann.
Yes,
Good
you
to
are.
see you.
It's so great to see you, and it's so great that you've tuned in today because we have another great story to tell. You know, let's kind of set the stage here before we bring our guest on, Jim, and that is, everybody needs people to work in their industry, right? There's food service workers shortage, there's truck driver shortage, school bus driver. I mean, it's across the board. But there's also a shortage of instructors. Let's just be honest about it, especially in the skilled trades and in nursing. At YTI and PCI, you're always looking for people who've been in their industry to give back and to, pass along their trade and their expertise to your students.
No, absolutely. And again, I think, for many people, they move through their career and they maybe at some point in their career have thought about teaching or helping develop the workforce of the future. Mm-hmm. And I don't think that folks don't really put that together until something happens. I mean, there's some either defining moment in their life or some situation that happens, and then they really consider it. And we're always on the look out for high quality people to come in and to help us teach our students.
Right.
And those folks have the ability to make a difference in not only that person's life, but also in the life of employers who make up our workforce.
Well, let's talk about one of those people. And you talked about the light bulb moment, and we'll get to that. So we've got Lisa Coe here, and Lisa has BSN and RN at the end of her name, and she is a practical nursing instructor at Porter and Chester Institute. She's got a lot of energy and a great story to tell. So first of all, Lisa, thanks for being on the program.
Oh, you're very welcome. I'm so happy to be here.
So let's talk a little bit about what are those credentials after your name, the BSN and the RN? I should know, but I don't.
That is okay. So I went to school to become a registered nurse back in 1980. Before I graduated in 1988, I went through a baccalaureate program, which was just gaining popularity at the time that I went through undergrad. And so my training allowed me to sit for the licensure board to become a registered nurse in the state of Connecticut. And the degree that I received was Bachelor of Science in Nursing. So the BSN is for Bachelor of Science in Nursing, and RN is for Registered Nurse.
Wow. So you've been doing this for a while, and you've had a successful career. Talk a little bit about where your career has taken you over the years, and then we'll get to the big reveal.
So my career has been very, very grounded in skilled nursing and long-term care. When I went to college, I knew that was the patient population that I wanted to provide care and services for. And so the majority of my work life has been spent in what you would consider the nursing home or skilled nursing facility, post-acute rehabilitation environment. I did the obligatory 2 years in hospital nursing, which is always recommended for new graduates to get strong assessment skills, to be able to react to emergency situations. And so I did those 2 years, but ultimately went on to long-term care, graduated up through the ranks, and for about the last 25 years, I've been a director of nursing services in one capacity or another in long-term care.
So let me ask you this question. Do you know this guy standing next to me, Jim Bologa? You ever met him before?
I have not. I feel like I have because Jim sent me a really interesting email one day, and I wish I could still find it in my LinkedIn, but I think he sensed that I was suffering the same burnout that many of my colleagues were suffering during the pandemic, and working long hours and just not getting ahead of this nursing shortage. And I think I'm going to paraphrase and say that he said, "Have you ever considered being a different part of the solution to the nursing crisis?" And I came across it, I think, a couple of days later and said, absolutely, yes, thank you, please. I think the undercurrent that I didn't write, because you don't want to scare off your new employer, was absolutely, please come rescue me. And from there, it was a conversation about what I could do to give back something, as you had said, to a career and a calling that I love. Mm-hmm. And it seemed like the perfect time in my life to make this decision.
Right. So, Jim, isn't it interesting, right? You never know. So you send Lisa a message on LinkedIn. Lisa's been doing this her whole life. And, in talking to Lisa previously, and I'm not saying this lightly, he changed your life, right, Lisa? Talk about that.
So at the risk of being what my mom used to call a professional crier, absolutely. I have not had a day since I made the decision to transition into my teaching career. I have not had one day of regret in making this choice. I feel like I think it's 2 months, just shy of 2 months, that I've been teaching with Porter and Chester. I've found a completely different work-life balance, for sure, but I've also found new meaning to my profession as a registered nurse. And that was important to me. I was so afraid that I was going to have to walk away from being a nurse. And if any old nurse, if you've ever had the opportunity to talk to an old nurse, I consider myself an old nurse, they will say the hardest thing about nursing is when you're no longer a nurse. It's so much in the fiber of who we become if we and who we identify as. And I was afraid I with the pandemic that I could no longer give back to the capacity that I wanted to be a supportive part of the industry. And along come Porter and Chester, and I've found something amazing. I've found something amazing that's renewed my commitment not only to my license as a registered nurse, but also to my calling, and that was the higher purpose.
Yeah, and that it's so it's great to hear all this, Lisa, because again, I'm fairly active on LinkedIn and other social media sites, and again, I really take great pride in trying to listen well to people around me, no matter where they're at, sort of in my circle of influence or circle of life, and one of the things that I have heard a lot from professionals in the healthcare sector, if you will, is that COVID was incredibly challenging and in so many different ways, and it affected everybody differently. And one of the things that I've made a bit of my mission is to try to make folks like yourself maybe a little bit more aware of the opportunities that exist in the broader healthcare world. And again, it's no surprise to anybody that there's a shortage in nurses right now. And there's a tremendous amount, I think, of younger people in the country who have interest in going into nursing. It's sort of like the chicken and the egg dilemma.
Right.
You need to have folks who've got the experience to come into the educational environment and provide the knowledge and the training and the education of the workforce of the future. And one of the things I really love about our education approach, our delivery method, is that students in the practical nursing program in particular, right now it's on ground. During COVID, they were able to do their lecture online, which many students I think appreciated. But now they're back on ground in classrooms, and then what they're able to do is take that theory, practically apply it in our industry modeled labs. And again, during COVID, we went out and we bought high fidelity mannequins for each of the 5 campuses that we have programs.
Her name is Annie.
Her name is Annie.
Resuscitation Annie.
Right,
They didn't
right.
name her after me, but
Right,
that's
right,
okay.
right.
But it's really, it's amazing because, Jim, to your point, you had to shift. You had
Yeah.
to shift how people are learning. You can't just stop saying we can't do
Right.
this because of COVID. So you've really kind of twisted it. So, Lisa, you're a perfect example of, someone who's made that switch. And what better people to be teaching students than people who've got all this experience?
Absolutely.
You called yourself an old nurse. I call it an experienced nurse. So what does a day in the life of instructing now for Porter and Chester Institute look like? You take students on their externships, correct?
Yes. In our field, it's called a clinical site. So we come to the clinical site in the morning, and as an instructor, I am greeting a class of approximately 7 to 10 students. I have students at varying levels of clinical capability. So I always have a group that has students with emerging skills, some with more proficient skills, and some who have been signed off as completely proficient in a specific skill area. So my job is to work side by side with the student to help them to do head-to-toe audits on all of our patients. It would be gathering information like vital signs and the patient's clinical presentation, looking for any issues regarding pain or difficulty breathing, skin issues, gathering all of that data that they'll be expected to be able to gather as licensed practical nurses. And then from that, helping them to learn how to formulate a plan of care that is specific and appropriate and patient-centered to that person. That's the very foundational aspect of nursing care. As they proceed further into their clinical skills, they begin to add additional clinical tasks such as providing wound and skin care, utilizing feeding tubes to provide tube feedings, doing medication passes. So all of those skill sets grow off of those initial foundational contacts that we have with our first patient at the bedside. And I think every nurse remembers his or her clinical opportunities as we were coming up in the ranks. We all have memories of the really helpful and beneficial clinical contacts that we had with our instructors, and the ones that we all also went through the ranks with those that we have some nightmares about. So I fortunately I'm not so far removed from my memories of those days that I want to help my students to fully embrace the entire identity of nursing and the art and science of nursing, to help the patients in our charge to be able to be placed in the best possible position for nature and science and whatever higher power to act upon them to total wellness. And that's a theme in my daily practice with my students.
Well, Lisa, and you talk about that, and regardless of what industry we're talking about, whether it's skilled trades, healthcare, that's what that's a feedback that you get from a lot of your students is not only the knowledge, the institutional knowledge that these professionals bring to the classroom, whether it's online or hands-on. So and then the passion for teaching, right? Because we can't pass along skills unless we have a good teacher. So it's so great to hear, Lisa, that your heart is in this thing. She was telling me when I talked to her earlier, she even has been able to invite her neighbor over for dinner that lives next door, which she hasn't been able to do in years, right, Lisa?
And I happen to own a small business with him. And so the fact that I haven't been able to invite him over in 2 years, and so the other exciting thing for any of my baccalaureate level and above registered nurse friends out there, if you want to give back to your industry in a profound and impactful way and leave your legacy, and I think it's important for us as we reflect on our nursing careers, to ask ourselves, what is my legacy going to be to this industry? How will I be remembered? And I want to be remembered by the patients to whom I provided care, but also to the nurses coming up, whether they were my students or new nurses that I worked with. I want to be remembered as the person who guided and supported them. So that's been the great joy. And I can't lie. The other great joy is not having to be mandated to work an extra shift, not being forced to work a 22-hour shift because there were no other staff people coming to relieve me, or having to make decisions about going home to see an ailing family member. Those were all things that we as nurses faced during the pandemic. And I don't regret that I was in that position for 2.5 years, but it's my time now to take a different look at my career. And I think a lot of my contemporaries are feeling the same way, but they just don't know, if it's something that they can do.
Well, let's get to that. And so, Jim, to Lisa's point, and we're going to wrap things up here in a little bit. So for those people who might be undecisive and wondering, should I do this or should I not? What is your advice for them, and how can people look into instructing in any of your program?
We're actually right now, we on our website, if you go to porterchester.edu, there is a section called We're Hiring. You can go check that out. Conversely, you can always email us at recruitment@porterchester.edu and send your resume and a cover letter. And so what we're doing is, again, we're trying to promote instructor opportunities through our existing workforce, as well as going out, into actively sourcing candidates who might have interest. One of the things that we're doing, like myself included, is I'm out on LinkedIn and I'm trying to connect with professionals like Lisa, and just simply stating.
Think about it.
Yeah, think about it, and stating sort of what I know you've been through, because I've listened to your colleagues tell me exactly what Lisa just said. I'm mandated to work another 8-hour shift at 10 of 3 when my shift ends at 3. I haven't been able, I've not been able to really get enough sleep every night. I haven't been able to get groceries this week because, I had to work a couple extra, a couple extra shifts. And I think what I'm trying to do with the healthcare employer community is also reach out to them and say, look, we recognize there's a shortage, but again, it's the chicken and the egg. We need to get folks like Lisa, to consider teaching and help support her. We take great pride and great effort. We're not perfect, but again, we go through an extensive onboarding process for folks to come in to get integrated. One of the things we often say to practitioners is you don't need teaching experience. We'll help you get there,
right?
In terms of all those aspects of being able to basically lead a classroom or lead a clinical environment. Some of this stuff does come naturally for folks because again, they've lived it, and they're going to provide insight that you're not going to get from a textbook.
Right. They've been there, done that.
Exactly.
And we can't feed the shortage unless we have the instructors to teach the students, right? Like you said, chicken and the egg.
Right.
Well, Lisa, I can tell you, I'm sure Jim is so glad that he wrote you that message on LinkedIn. I think go ahead.
I actually found the message.
Okay.
And I'm glad that I did. I'm a sentimental person. And in the message, and this is on April 13th, he sent me a message, and part of it was, please let me know if you or any of your colleagues would have an interest in teaching and helping me part of trying to reduce the nursing shortage. And it hit me like a ton of bricks, and I'll tell you why. The next day was my daughter's birthday. She is also a registered nurse, and she works in critical care through the pandemic. And we haven't seen much of each other because we've been isolating so that we wouldn't make one another sick.
Right.
And I was not able to spend her birthday with her for the first time in 34 years because I had to work a double shift, and I couldn't get out of it. And it was not a day that I'm scheduled to work, and as a salaried person, I also didn't get paid.
Yeah.
So just an example of work-life balance right there.
Yeah, and I would just simply say, I mean, I think timing is everything, and Lisa. I mean, right? I mean, it's just, I mean, I think folks get to getting ideas in their head, and they start to think about those ideas, and then there's a moment that happens that helps sort of just commit that idea in your head to action, and then you take action. I mean, we're always in the market looking for quality instructors, again, whether it's in nursing or, medical or dental assisting, or any of the skilled trades. So whether you're an electrician or an HVAC technician, a plumber, a low voltage technician, an automotive technician, I mean, we are always looking for folks to give back. Our success as a country is being able to take young people and I would say not so young people,
right?
Because we just had a student on who was a microwave recipient who's in his mid-50s.
Right. It's never too late to make a change, right? And make it for you. Make it for quality of life. Really sit down and is it about the paycheck or is it about the quality of life? I think we've all kind of had that moment of re-examination of what matters and what doesn't. And Lisa, you're a perfect example. I'm glad you won't have to worry about your daughter's birthday next year, that's for sure.
Oh, you better believe it. Already planned.
There you go.
Yeah.
So we want to encourage people to go to porterchester.edu for all the information. And what's the other recruitment website?
Yeah. So if you want to send us an email with a cover letter and your resume, you can send that to recruitment@porterchester.edu.
Okay, so think about it. It's worth thinking about. Lisa Coe, thank you so much, and continued success to you. This was a real eye-opener, I hope, for all of you who tuned in to this edition of Inside Career Technical Education. On behalf of myself, Ann Baldwin, and Jim Bologa, thanks so much for tuning in. We appreciate it.